am Claudia Seabra, a professor at the Faculty of Arts and Humanities of the University of Coimbra in Portugal. My research mainly focuses on safety and risk in tourism. In the last 2 years, I investigated the impacts of the COVID-19 pandemic in the tourism consumption, especially using the generational approach. Segmentation based on generations derives from the assumption that the time in which a person was born, the experiences he went through, and the environmental context in which he grew up will affect his behavior, attitudes, and values. I am one of the authors of the study Restrictions, Acceptance, and Risk Perception by Young Generations in a COVID-19 Context, published in 2021 in the International Journal of Tourism Cities. Our main goal in this work was to analyze the safety perceptions to travel and the level of acceptance of restrictions by people from the generations Y and Z, both as tourists and as host communities in 3 important receiving countries: Egypt, Portugal, and Turkey. Starting on the reason why we choose to analyze the younger generations is because Generation Y and Z represent the future of tourist markets. In fact, in the next 10 years, they will represent the biggest segment of every sector demand and about 75% of the global workforce as well. Also, youngsters are powerful influencers on people of all ages and incomes. In this line, the research on the habits and behaviors of these generations is crucial to understand and foresee tourism industry sustainability. In the first year of the pandemic, travel restrictions spread over 90% of the world's population, not only at the international but also in some countries at the domestic level, affecting national economies and mainly the tourism industry. These measures and restrictions saved millions of lives. However, they also contributed to the spread of global fear fueled by the media and had a strong impact on citizens' daily lives, mobility, future, and travel plans. Several studies showed that COVID-19 had a high prevalence of psychological stress and anxiety, and this was particularly real for the younger generations. They had very active and exciting social lives that had to be stopped completely due to the health risk and because of the restrictions. So what did we conclude? Overall, the study concluded that the pandemic had a strong impact on the perceptions of safety in the daily lives of young people. There was an unanimous opinion on the urgency of altering daily routines and future travel plans, as well as the belief that citizens and tourists were potential victims of the disease. Regarding the measures and restrictions that governments have imposed in the context of the pandemic, in general, young people agreed with their imposition. However, the measures had different impacts on millennials and Generation Z in the 3 countries. Turkey residents, for instance, had higher levels of agreement and were more concerned about the disease than the Egyptians and the Portuguese. The young Portuguese people felt less comfortable with restrictive measures because they were less concerned about the disease, as were the young Europeans. This cross-cultural study was able to show that the tourist and residents' attitudes depended not only on cognitive and affective patterns, but also on their social, political, and cultural environments. This was a very interesting project among researchers that didn't know each other before the pandemic. So we can say that COVID-19 also brought some positive things, namely this urgency of researching the present with colleagues from all over the world. The present status of the world, when we fear for peace more than ever during our lifetime, is a good opportunity to continue to study the present and continue cross-cultural studies.